living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Nursing homes have done everything they can to keep our vulnerable and aging residents safe and healthy during COVID-19. As we head into the holidays and colder months, what can we do to help facilities and those we love be safe? Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back. I'm joined today by Eric Boley, President of Leading Age of Wyoming and also President of the Wyoming Hospital Association. Thank you so much, Eric, for joining us today.
You bet, it's my pleasure.
Well, we know you're busy for sure, absolutely. So first of all, talk to our viewers about what is Leading Age.
That's a good question. Leading Age Wyoming is a chapter of Leading Age National, which is a trade association that represents nursing homes, assisted living, home health agencies, and others from all across the country. So we do advocacy and represent the nursing homes, mainly nonprofits, but also for-profit nursing homes that have similar visions when it comes to quality of care that's delivered to the residents.
What part does Leading Age play in nursing home regulations?
On a national perspective, they're very active with Congress back in Washington, D.C. Also on a state level, we work closely with our state legislation to pass bills and legislation that benefits the care of our seniors, our elderly.
What about regulations relating to infection control or infection prevention?
You know, that's an important topic, especially right now during COVID. We work closely with our state licensing agency, and obviously it's a source of major concern right now. So we're constantly working to make sure that we have the best practices in place as far as infection prevention is concerned. And we are constantly looked at by the state agencies. They come in and survey to make sure that we're conforming to all the best practices and doing what's necessary to protect those that we care for.
You know, you bring up COVID-19, and that's on everyone's mind for sure. So let's talk about nursing homes and that topic. What can nursing homes and long-term care facilities do about infections, and why are they hotspots for infections and COVID?
Well, you know, that's a really good question, and it's a tough question. As we've seen nationally, long-term care facilities are a hotbed for COVID, and a large majority, I think it's up to 80% of the deaths that have been diagnosed and attributed to COVID have taken place in our elderly population. And so from a long-term care facilities perspective, their ultimate goal is to protect those that they care for. We've seen guidance come out from CMS and from CDC that has restricted visitation. The staff members are going through regular screening to make sure that they're not bringing COVID into the facilities where they've been entrusted to treat those that stay there. We're doing all we can to try and keep COVID out. And as we've seen, we've had outbreaks. We've been lucky in Wyoming, but we've had a few outbreaks in our nursing homes. And when it gets in, it's terribly deadly.
Can you talk to us about what kind of COVID-19 testing is done in nursing homes?
Sure. So that, you know, early on, testing was really difficult. There weren't enough reagents. There weren't enough supplies available, but our state lab has really beefed up and come through with supplies. And so they're doing random testing of staff members on a weekly basis. A certain percentage of employees are tested. When potential COVID is determined to be present, then 100% of testing is done on all residents and all staff members. And so they're taking a very, very proactive approach to make sure that those that are caring for residents don't have COVID. And when they do, they're immediately isolated and sent home to make sure that the COVID isn't spread throughout the facilities.
Besides the COVID-19 testing, what other precautions are the facilities really honing in on to prevent any outbreaks and becoming a hotspot?
Well, I think I touched on it briefly, but visitation, they've stopped visitation for a period of time, keeping outsiders from coming in. Deliveries of supplies and food and other things are done where the deliverymen don't enter the building. We have started to see some easing in the restrictions and visitation, but visitation has only been allowed outdoors, and it has to do with how many cases are in each of the communities where those nursing homes are located. So there's very strict guidance, and we're taking a very cautious and measured approach to allowing visitation. Staff members are asked to screen daily to make sure that they don't have fevers, they're not showing any signs or symptoms, and if they are, they're asked to stay home. And so they're doing all they can to keep it from entering in any possible way.
You know, we've got about a minute left, Eric. Let's focus on something positive. Give us one or two successes your long-term care facilities have been able to achieve.
Well, I'm proud of the nursing homes in Wyoming. I'm proud of the work that they've done. There are heroes in every one of those facilities, and I think they're unsung heroes. They put their own families at risk. They've given up time with their families to care for the elderly. We really appreciate them for what they're doing, and they need to be recognized for the sacrifices they've made to take care of others.
Eric,
we've been lucky. We've kept COVID out of most of our nursing homes for an extended period of time and bucked the trends that we've seen in other states and other areas.
well, we couldn't more heartedly agree with you. They are unsung heroes. Thank you so much, Eric, for being with us today. And we're going to take a break, folks. And when we come back, we're going to be talking about nursing home resident rights. So please stay tuned. Welcome back. We are now joined by Jill Holt, who is certified in nursing home infection prevention, and she has worked in the nursing home industry for quite a while. So Jill, thank you so much for joining us.
My pleasure, thank you.
If I have a loved one in a nursing home or assisted living, how can I stay informed on what that nursing home is doing to keep my loved ones safe because of COVID-19?
Good question, Sarah. I would recommend that you stay informed by taking a look at the website. Many facilities have websites now, and they keep those very current. They're adding information each day or routinely when there are changes. So that's one way of staying in touch. And then just the good old-fashioned way of having a contact person within the center that you trust, that can speak to your questions and concerns that you frequently have. And so calling the center and reaching out to the social worker or perhaps a nurse on the floor or a manager is also a good way to stay informed about things that are happening within that center. And then, of course, your loved one. Your loved one, if they're able to share experiences, would also be a good resource and a way for you to measure and determine how things are going within that center.
Are nursing homes required to notify the family or the community if either a resident or a staff person at the facility tests positive for COVID-19?
Nursing homes are required to report positive cases of COVID, either from a staff member or a resident within their center. it's a little bit tricky because nursing home residents have the right to determine who they want informed of their care status and of their living status within a center. And so as long as the resident has authorized the facility to contact you as a responsible party or a contact person for that particular resident, then the nursing home would be obligated to reach out to you and keep you informed of the status of the residents and the staff within that center.
I've heard instances of where families want to take their loved ones out of the nursing home during the pandemic. What are your thoughts or advice there?
Well, that is certainly understandable. I can appreciate that desire, and I think it's even more compounded now with the lack of ability to visit freely like you used to be able to do when somebody's in a nursing home. And so I appreciate that concern. I would just exercise caution when giving that thought. There's usually a reason that person is in that center. They probably require 24-hour skilled care. And so as long as a family member, you have the ability to provide those needs and meet the needs safely of that particular resident, should you determine that it's better for you to provide the care in your own home, I think that's a real consideration. And for many years, I've cautioned and just asked staff members to be sure that they aren't compromising their own health and safety, because if they're the caregiver and the only caregiver perhaps for 24/7, then oftentimes caregivers are then compromised providing care. So then you're no good at all to that person that you're concerned about. So there are things to consider certainly when making a decision about whether the nursing home is still the best site for providing care.
If a family member has a concern about their loved one and something's going on in the nursing home and they're really concerned about it, what should they do?
Well, they should absolutely reach out to that nursing home personnel. And good nursing home providers welcome communication and welcome questions. They're not offended by that reach from you, and they embrace that. As a matter of fact, they recognize that together you will provide better care for that particular loved one of that family member. And so I would urge you to instantly, as soon as you can, reach out to personnel within the center. Physicians, the physician for your loved one is also a good resource if you felt like there was a barrier in your communication with the center. And so that's a possibility. And then there are ombudsmen. Every center is assigned an ombudsman who is a neutral person and party that can also serve as an advocate and a resource for communication should you have the inability to communicate directly with that center or its staff.
You know, I'm glad you brought up the ombudsman. So how would a family member contact that particular individual?
The ombudsman is always, their contact information is listed within the center itself. And so the staff members would be able to provide that information. In addition to that, it's on websites for the departments of health in your respective states. They're employed by the health department in the state of which you reside. And so that information is accessible via those sources.
Jill, we've got about a minute left, and we touched on resident rights. I know there are federal and state regulations. Talk to us about what examples you might give about those rights.
Okay, sure. That's a good question. If you think of it this way, residents have the same rights that you and I have in our own homes. We have the right to be safe. We have the right to embrace or reject medical care and treatment recommendations. We have the right to have access to our mail. We have the right to be free of pain. We also have the right to vote. That's a big issue coming up here around the corner. So every right that you have within your own home should align with the rights of nursing home residents.
Thank you so much, Jill. That was great information. Folks, we need to take another break, and when we come back, for those of us who have loved ones in a nursing home, we have the holidays coming up, and we're going to learn more about what we can do to keep our residents in those nursing homes safe. So stay tuned. Welcome back. Jill Hult is still with us to talk about nursing home care in COVID-19. One of the things we're going to talk about is visitation and staying connected to our nursing home residents. So Jill, thank you so much for staying with us and sharing your expertise.
Thank you, Sarah.
Nursing homes have modified their visitation policies, particularly during COVID-19 for sure. So if someone wants to visit a loved one, what should they do?
Well, Sarah, they should first call the center and determine what their visiting policies are. They can be somewhat fluid and flexible based on the percentage of COVID in the community. And so the first thing that anyone should do is first call the center. And for those that are offering visitation indoors right now, they are requiring you to make an appointment, and there are certain timelines that are available for visitation. And so that should be their first course of action, is to contact the center and see what's available.
You know, the holidays are just around the corner, and of course people want to visit loved ones during the holidays. So I'm sure there's some special considerations there. So what about that?
Well, the holidays are generally speaking, they can be a very joyful and yet very stressful time for those living in nursing homes. And this is just further exacerbated by the COVID-19 restrictions. And so right now there's some very meaningful testing underway and studies being done to try to make nursing home visits safer all the time. So we have a little time before the holidays are here for more progress in that regard. But in the meantime, it would be a good idea to start thinking about ways you could have a meaningful holiday in the event that you can't physically be present with your loved one. I would beef up on my technology. I would begin to think about ways that you can gather your family remotely. I would also begin to give some thought to traditions that your loved one may have enjoyed while being able to be with you. Maybe it's a special cookie that you made as a family. Things that would be memorable for that person and help them to feel connected in the event that being side by side or face to face during the holidays is not safe. So I think it's a good idea to start to begin to have options for meaningful contact that may not be in person.
What about trying to take a loved one out of the nursing home for a holiday celebration? Talk to us about that.
Well, as we talked in a previous session, nursing home residents have rights, and they do have the right to leave the facility, and they do have a right to make that decision about whether that's best for them or not. And so should it be determined that it is important and the risk-benefit ratio is such that leaving the center for a visit with the family is a good idea, then there are some thoughts to keep in mind when that happens. So if my mother were living in a nursing home, if she wanted to come to my home for the holiday, then she should be aware that upon her return to the center, she will be likely required to be in isolation for up to 14 days. And the reason for that is because if my mother came to my home, she could very well have been exposed to someone unknowingly that had COVID. And then my mother could be then a candidate for taking COVID back into the center. And the center, though you have a right to leave and go visit, the folks that live in that center with you maybe didn't make that same choice or decision. So to protect them and others, then in that case, my mother in this example would be required to be in isolation following that outing, and then she would be subject to increased surveillance just to make sure that she hadn't contracted COVID while out on a visit. So it is possible. There are just exercises and steps that need to be taken as a precaution should that choice be made.
So no one would refute the fact that the COVID pandemic has affected all of our morale for sure. But talk to us about the morale of nursing home residents during this pandemic.
Well, we're seeing now the effects of the isolation on nursing home residents, and it's for that reason I believe that CMS, Centers for Medicare and Medicaid Services, initiated a new visitation guideline, which came out in the middle of September. And I think it's because of that awareness now that we have of the impact of isolation and loneliness has had on residents that are in the nursing home. But having said that, I have to just share that I look on social media, and every day I am just in awe of the creativity and the things that nursing home personnel are doing and the lengths that they go to bring joy and to bring things to look forward to and to keep those activities and those exchanges meaningful and creative and exciting and interesting. And so nursing homes are just remarkable and ingenious when it comes to doing a lot with little. And they're doing a great job of trying to keep the morale up of their residents and trying to do new things that stimulate them and give them something to look forward to.
So we've got about a minute left, and usually the holidays folks want to help out. They want to help nursing homes, etc. If someone wanted to do that around the holidays, give us a few tips of advice.
Okay, certainly. Thank you. That's a good question. I think that the best advice would be for you to call the center with which you're affiliated with, or that you're thinking about in your neighborhood, or a loved one is residing in, and I would inquire of them. Every center has uniqueness and needs that are different than other people, and so I would call there and ask them what they see as a need for the folks living in their center.
Well, that's excellent advice, Jill, and you have shared so much valuable information. Thank you so much. And thank you to Eric for sharing all of his wisdom, and thank you to our viewers for staying with us. And don't forget to join next week. And in the meantime, stay fit, stay well, stay healthy for life with Healthy Living for Life. Take care, everyone.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.